What is BPH?
BPH is a benign enlargement of the prostate gland. It's a condition that occurs in men as we age. It causes obstruction of the urethra. In other words, as the prostate gland enlarges, urethra can become pinched and compressed, and that leads to a set of symptoms that we call lower urinary tract symptoms. The symptoms could be obstructive symptoms such as hesitancy, slow stream, and incomplete bladder emptying. It could also be irritative symptoms, which is urinary frequency, a sense of urgency, and getting up multiple times during the night.
What causes BPH? And is there anything that we can do to prevent BPH?
BPH is a secondary enlargement that occurs in the prostate gland in all men beginning around age 45 to 50. It's under hormonal control, and as it occurs, the symptoms tend to be progressive. There's not a lot that can be done to completely prevent BPH, although eating a healthy diet low in fat is helpful. In addition, men can avoid certain over-the-counter antihistamines and decongestants that may aggravate the symptoms.
How common is BPH?
BPH is very common in men over the age of 50. In fact, 30% of men at age 50 will require some sort of treatment for BPH.
What are the symptoms of BPH?
Initially, there may be little or no symptoms of clinical BPH. However, as time goes on, men develop obstructive symptoms. This could include difficulty starting urination, urinary hesitancy, urinary intermittency where the stream will stop and start, and as time goes on, men develop incomplete bladder emptying secondary to BPH. Some of the most bothersome symptoms, however, are irritative symptoms. These include urinary frequency, urinary urgency where men have to run to the bathroom, and sometimes even to the point of urge incontinence. In addition, nocturia begins to occur, and on the bother scale, nocturia, waking up at night, is one of the most bothersome symptoms that men experience. The symptoms progress over time, and in some cases have actually led to urinary retention where the bladder becomes decompensated and isn't able to empty at all.
How does BPH affect quality of life?
This can affect sleep patterns. Some men have difficulty getting back to sleep once they've awoken. In addition, the urinary frequency component is of great bother, especially if it's accompanied with urgency. There have been cases where men have had episodes of urinary incontinence because they weren't able to get to the bathroom quick enough.
How is BPH diagnosed?
BPH is diagnosed first and foremost based on the clinical symptoms in men over the age of 45. The digital rectal exam is helpful at monitoring the texture and size of the prostate. As BPH progresses, it's often monitored with uroflow studies that will provide a graph of the urinary stream, and a bladder ultrasound can help us check the residual in a non-invasive way to see how well the bladder is emptying. The two most important diagnostic tests, however, are the clinical history and the digital rectal examination. PSA can be performed in some cases if there's any question of needing to help exclude a diagnosis of prostate cancer.
What is a DRE?
A DRE stands for digital rectal examination. It's a finger examination of the prostate that allows the urologist to rule out prostate nodules, to get a sense for the overall size of the prostate. It's also useful at excluding early rectal carcinoma. It often is used with other diagnostic modalities, including prostate ultrasounds in some cases, if a more accurate volume of the prostate is necessary.
How is BPH treated?
This could include dietary changes, such as minimizing the use of caffeine. In some cases, medications known as alpha blockers are utilized. They relax the alpha receptors in the levator muscles and in the prostatic urethra to facilitate improving a urinary stream and helping the bladder empty more efficiently. There are also 5-alpha reductase inhibitors that actually have the ability to shrink the prostate. The problem with the medical therapy, especially the alpha blockers, is that although it improves the symptoms of BPH, the disease continues to progress as anatomic changes are not noted. 5-alpha reductase inhibitors will anatomically change the prostate, but they're associated with sexual side effects, including decreased volume of ejaculation and in some cases erectile dysfunction. In some individuals, medical therapy either fails or is not acceptable, and then patients are advised to consider minimally invasive treatments, which could include microwave therapy, Prostiva, which uses radio frequency to help ablate the prostate, or even Urolift.
What were your symptoms like prior to the Prostiva?
My symptoms were lack of ability to urinate timely. I felt like I had to urinate all the time, and I would go in and I would try. It would be for 3 or 4 seconds, and I couldn't complete it. So basically, I couldn't pass a gas station, and I was never satisfied. I was miserable.
Why did you choose Prostiva?
Well, there was 2 or 3 options I believe he gave me. One was called a turret procedure, the other was called Prostiva. But I had read the information on the Prostiva, and it seemed like the safest thing for me to do at the time. So I tried it, and it seemed to work out very well.
What is your quality of life now after Prostiva?
Well, it seems like I've been given a new life, because now I can urinate whenever I need to. I don't have the sense of urgency that I used to have. It's been great ever since, but now life just seems to get even better.